CNA Practice Questions. Welcome to the quiz. Question 1. The use of assistive devices during patient ambulation requires understanding their primary purposes and proper application techniques. As you prepare to assist Mrs. Williams, an 88-year-old resident with generalized weakness and balance issues, with her first ambulation attempt since hip replacement surgery, you secure a gait belt around her waist. What represents the fundamental purpose of utilizing a gait belt when assisting a patient with ambulation, particularly one with mobility challenges? Option A. To completely prevent the patient from falling during ambulation activities. Option B. To provide the CNA with secure handholds for offering support and stability. Option C. To enable the patient to walk at a faster pace than would otherwise be possible. Option D. To reduce the amount of physical assistance required from healthcare staff. The answer is B. A gait belt's primary purpose is to provide the healthcare worker with secure handholds to offer support and stability during transfers and ambulation. It creates safe grasping points that allow the assistant to guide. Question 2. While assisting a patient with advanced Parkinson's disease during the noon meal in the dining room, you notice subtle but concerning signs during the feeding process. Mr. Thompson, who has known dysphagia, begins coughing intermittently, his voice becomes gurgly after swallowing, and he appears to be having increased difficulty managing his food bolus. In this situation, what immediate action should you take to prioritize patient safety and prevent potential complications? Option A. Offer him a small sip of water to help clear the food particles from his throat. Option B. Stop feeding immediately and maintain the patient in an upright position. Option C. Encourage him to take smaller bites of food and chew more thoroughly. Option D. Ask him to cough forcefully several times to expel any trapped material. The answer is B. When signs of aspiration risk appear. Question 3. An elderly resident with moderate Alzheimer's disease residing in the memory care unit repeatedly asks about her deceased husband, whom she believes is still alive and will be visiting her shortly. Mrs. Anderson becomes increasingly anxious when staff members provide reality orientation about her husband's passing 5 years ago. Which approach represents the most therapeutic and compassionate response to her repeated inquiries about her deceased husband? Option A. Firmly remind her that her husband died 5 years ago and encourage her to accept this reality. Option B. Acknowledge her feelings and redirect her attention to meaningful activities or memories. Option C. Distract her by changing the subject entirely and focusing on immediate needs like meals. Option D. Question why she keeps asking about him when she's been told multiple times he's deceased. The answer is B. With dementia patients. Question 4. Following an exposure to a patient with suspected tuberculosis, you must don personal protective equipment before entering the airborne infection isolation room. Understanding the proper sequence for applying PPE is essential for both effectiveness and safety. Which of the following represents the correct order for donning personal protective equipment when preparing to enter an isolation room requiring full barrier precautions? Option A. Apply gloves first, followed by gown, then mask, and finally protective eyewear. Option B. Put on the gown first, then the mask or respirator, followed by eyewear, and finally gloves. Option C. Don the mask initially, then protective eyewear, followed by gown, and complete with gloves. Option D. Start with protective eyewear, then mask, followed by gloves, and finish with the gown. The answer is B. The correct sequence is gown first. Question 5. Documentation represents a critical component of patient care with important legal and clinical implications. As you complete your shift duties, you reflect on the fundamental principles that should guide all nursing assistant documentation entries in the patient's medical record. Which principles should serve as the primary guideline for all CNA documentation practices regarding patient care activities? Option A. Document only positive observations and interventions that reflect well on the care provided. Option B. Adhere to the standard that if care wasn't documented, it's considered not to have been done. Option C. Keep all documentation entries brief and general to avoid excessive time commitment. Option D. Complete all documentation at the end of your shift when you can concentrate fully. The answer is B. The legal principle, if it wasn't documented. Question 6. A 74-year-old patient with a history of congestive heart failure who is taking furosemide, a diuretic medication, reports feeling lightheaded and dizzy when transitioning from sitting to standing positions. Mr. Jenkins nearly lost his balance this morning when getting out of bed, and he describes seeing black spots when he stands up quickly. Based on his symptoms and medication regimen, which specific condition should you suspect and promptly report to the nurse? Option A. Uncontrolled hypertension with elevated systemic blood pressure. Option B. Orthostatic hypotension related to medication-induced volume depletion. Option C. Hyperglycemia potentially indicating undiagnosed diabetes mellitus. Option D. Urinary tract infection causing generalized weakness and malaise. The answer is B. The symptoms describe orthostatic hypotension, postural hypotension. Great job! Don't forget to subscribe. Bye.